Good afternoon. I would like to thank everyone at the Puerto Rico Chamber of Commerce, its President Juan Carlos Agosto, and my friend Luis Pizarro, who chairs this Puerto Rico Health and Insurance Conference, for the invitation to address you on an issue that is so important to all of us, the health of our people in Puerto Rico. If there is one thing that the COVID-19 pandemic made glaring, it is that inequities and deficiencies to proper healthcare access have dire ramifications and negative impact on all aspects of our society. We have seen this past year how lack of access to an adequate public healthcare system can affect everyday people. Moreover, the lack of control over important facets of the health industry and dependence on foreign supply chains were able to disrupt our commercial ecosystem, displacing our working class and causing a worldwide economic downturn. Each challenge we face as a society also highlights, time and again, the deficiencies and inequities of our second-class American citizenship. The numerous difficulties Puerto Rico is going through affect us all, but systemic inequality means that the weight of the crisis falls more heavily on some sectors than on others. Among the most severe and painful failures, without a doubt, is the lack of access to a robust, fair, and high-quality healthcare system that responds to the needs of all Puerto Ricans, in particular to the most vulnerable sectors of our society. We are, once again, facing a shortfall on Medicaid funds, known as the Medicaid fiscal cliff, which threatens our capacity to continue providing healthcare services to the most vulnerable sector of our population. If Puerto Rico were to hit the cliff on September 30th, 2021, federal Medicaid funding would revert to about $392.5 million from the current $2.8 billion a year that Congress allocated for this fiscal year. The remaining Medicaid expenditures would have to be covered with local funds. That is why my administration has been, since its beginning, urging Congress and the Biden-Harris administration to put an end to the undignified treatment of the U.S. citizens residing in Puerto Rico. The market economic development in general, and particularly the healthcare industry, cannot flourish or operate under the shadow of uncertainty. It is time to move away from the uncertain and unstable piecemeal funding of our Medicaid program and move to a program similar to the ones available in the States. That is, having an FMAP based on Puerto Rico's per capita income relative to the rest of the nation and eliminating the cap, which in turn causes us to have to finance the majority of the cost of providing health care to all. I support the efforts of Resident Commissioner Jennifer Gonzalez Colon and others in Congress to propose changes in Medicaid funding for Puerto Rico that are big, bold, dramatic, and historic, in keeping with the changes this Congress already has enacted with respect to the application of the child and earned income tax credits in Puerto Rico. The government of Puerto Rico recognizes that state-like treatment will require an expansion of the Medicaid services offered in Puerto Rico. I have already requested that we start planning the implementation of those additional programs. I strongly believe that the American citizens in Puerto Rico with limited resources should have the same basic healthcare services that their fellow citizens enjoy anywhere else in the United States, and we're prepared to work with the Congress to transition promptly to a fully funded state-like Medicaid system. Achieving state-like treatment in Medicaid funds will allow us to offer more and better benefits. These may include funds to cover the Medicare Part B premium cost so that our seniors can keep more of their money from their Social Security checks, and better services through the Platino program's coverage. The Platino program is part of the Puerto Rico Medicaid plan and serves 280,000 elderly and indigent in our population. In addition, we will be able to include long-term care benefits, home care, non-emergency medical transportation, vaccines for adults, and emergency services for foreigners, regardless of their immigration status, among others. The problems and consequences of unequal treatment affect us all. This being so, it is incumbent upon all of us to come together to identify and advocate for the solutions that will better serve the 3.2 million American citizens living in the island. It is with that in mind that today I am announcing that I will be issuing an executive order to appoint a multi-sectoral group that will include representatives from both the public and private sectors, both for-profit and non-for-profit, that will advocate before Congress and the White House for state-like treatment in Medicaid and Medicare funding in Puerto Rico. This group, led by my team at the Puerto Rico Federal Affairs Administration in Washington, D.C., and in close coordination with our resident commissioner, will jointly outline and execute the work plan to put an end to the unequal and discriminatory treatment of the U.S. citizens residing in Puerto Rico. I count on all of you here today to make this joint effort a successful one that will put Puerto Rico on a path to equal treatment with their fellow citizens in the 50 states. Thank you.